Certified nursing assistant professionalism and role of the nurse aide.
Question 1. True or false, it is okay to accept a small cash tip from a resident's family? Option A, true. Option B, false.
The correct answer is option B, false. Professional ethics and facility policies strictly prohibit the acceptance of tips or gifts.
Question 2. True or false, a nursing assistant should follow the facility's chain of command? Option A, true. Option B, false.
The correct answer is option A, true. Following the chain of command ensures that information and concerns are handled by the correct supervisor.
Question 3. Who is the director of nursing in a long-term care facility? Option A. The person who manages the facility's budget. Option B. The physician who oversees all medical treatments. Option C. The registered nurse responsible for the entire nursing staff. Option D. The person in charge of resident activities.
The correct answer is option C, the registered nurse responsible for the entire nursing staff. The director of nursing is the highest-ranking administrative nurse who oversees all clinical operations.
Question 4. The term ethics is best defined as which of the following? Option A. The legal laws governing a state. Option B. The knowledge of what is right and wrong. Option C. The facility's policy on vacation time. Option D. The religious beliefs of the nursing staff.
The correct answer is option B, the knowledge of what is right and wrong. Ethics involve the moral principles that guide professional behavior and decision-making.
Question 5. What does the acronym HIPAA stand for? Option A. Health Intake and Patient Assessment Act. Option B. Health Insurance Portability and Accountability Act. Option C. Hourly Informed Patient Activity Area. Option D. Hospital Information and Privacy Access Agency.
The correct answer is option B, Health Insurance Portability and Accountability Act. This federal law protects the confidentiality and security of a person's health information.
Question 6. In terms of documentation, what is objective data? Option A. Information that a person tells you. Option B. Information that is seen, heard, felt, or smelled. Option C. The opinions of the nursing assistant. Option D. A guess about a resident's health.
The correct answer is option B, information that is seen, heard, felt, or smelled. Objective data is also known as signs and can be measured or observed.
Question 7. In terms of documentation, what is subjective data? Option A. Information you can see with your eyes. Option B. Information a person tells you that you cannot observe through your senses. Option C. The resident's pulse and blood pressure. Option D. The weight of the resident.
The correct answer is option B, information a person tells you that you cannot observe through your senses. Subjective data is also known as symptoms, such as the resident saying they have a headache.
Question 8. What does the abbreviation DON stand for? Option A. Daily Observation Note. Option B. Director of Nursing. Option C. Department of Nutrition. Option D. Director of Nutrition.
The correct answer is option B, Director of Nursing. The Director of Nursing is the registered nurse in charge of the entire nursing department.
Question 9. A resident claims he cannot find his dentures. As a nursing assistant, it is your responsibility to do what? Option A. Document the loss in the patient's medical record. Option B. Tell the resident that you will notify the family contact member. Option C. Ask the resident to refrain from eating until the dentures are located. Option D. Notify the supervising nurse.
The correct answer is option D, notify the supervising nurse. Reporting missing personal items to the supervisor is the correct professional protocol.
Question 10. Which of these best describes how accurate documentation assists the healthcare team? Option A. Determining if interventions in the care plan are effective. Option B. It is primarily a means for defending a staff member's behavior. Option C. It is more important to talk to residents than to document. Option D. Realistically, it does not happen as often as it should.
The correct answer is option A, determining if interventions in the care plan are effective. Accurate records allow the team to evaluate the success of the resident's treatment plan.
Question 11. A resident makes a comment that is sexual. Your best response is to do what? Option A. Make a humorous comment in return. Option B. Let the resident know that the comment is not acceptable. Option C. Walk away and pretend you did not hear it. Option D. Change the conversation to a different subject.
The correct answer is option B, let the resident know that the comment is not acceptable. Setting firm professional boundaries is the correct way to handle inappropriate behavior.
Question 12. A resident is pacing around his room, yelling and swearing. What is the first action? Option A. Call the resident's family to assist. Option B, tell the resident to calm down. Option C, attempt to apply restraints. Option D, call the charge nurse.
The correct answer is option D, call the charge nurse. Agitation must be reported to the supervisor to identify the cause and ensure safety.
Question 13. To whom does the certified nursing assistant report directly? Option A, the nurse supervisor. Option B, the physician. Option C, the staff development nurse. Option D, the administrator.
The correct answer is option A, the nurse supervisor. The charge nurse or supervisor is the immediate superior in the nursing chain of command.
Question 14. If you are concerned about client care, whom should you speak to first? Option A, another nursing assistant. Option B, the nurse in charge. Option C, the director of nursing. Option D, the administrator.
The correct answer is option B, the nurse in charge. Following the chain of command means reporting concerns to your immediate supervisor first.
Question 15. If an alert client touches you inappropriately, what is your best response? Option A, slap the client's hand. Option B, step back and ask them not to do it again. Option C, refuse to care for the client. Option D, warn them they will be punished.
The correct answer is option B, step back and ask them not to do it again. Setting firm professional boundaries is the correct way to handle the situation.
Question 16. What is the role of the director of nursing? Option A, to cook the facility meals. Option B, to manage the facility's finances. Option C, the registered nurse responsible for the entire nursing staff. Option D, to drive the resident transport bus.
The correct answer is option C, the registered nurse responsible for the entire nursing staff. The director of nursing is the highest clinical authority in the facility.
Question 17. What are ethics? Option A, the rules of a card game. Option B, knowledge of right and wrong. Option C, the laws of the state. Option D, the medical history of a resident.
The correct answer is option B, knowledge of right and wrong. Ethics guide the professional behavior of healthcare workers.
Question 18. Who is the director of nursing? Option A, the person who cooks the meals. Option B, the registered nurse responsible for the entire nursing staff. Option C, the doctor who owns the building. Option D, the resident advocate.
The correct answer is option B, the registered nurse responsible for the entire nursing staff. The director of nursing is the highest clinical administrator in a facility.
Question 19. What is the definition of ethics? Option A, the laws of the state. Option B, the knowledge of what is right and wrong. Option C, the facility's dress code. Option D, the religious beliefs of the doctor.
The correct answer is option B, the knowledge of what is right and wrong. Ethics guide the moral and professional behavior of healthcare workers.
Question 20. True or false, it is okay to accept a cash tip from a family? Option A, true. Option B, false.
The correct answer is option B, false. Professional ethics and facility policies prohibit the acceptance of gifts.
Question 21. True or false, a nursing assistant should follow the chain of command? Option A, true. Option B, false.
The correct answer is option A, true. The chain of command ensures that care and concerns are managed by the correct supervisor.
Question 22. To whom does the nurse aide report directly? Option A, the nurse supervisor. Option B, the physician. Option C, the staff development nurse. Option D, the administrator.
The correct answer is option A, the nurse supervisor. The charge nurse or nursing supervisor is the immediate superior in the clinical chain of command.
Question 23. While making an empty bed, a nurse aide sees that the side rail is broken. What should they do? Option A, wait for the next safety check to report it. Option B, report the broken side rail immediately. Option C, tie the side rail in the raised position. Option D, warn the client to be careful.
The correct answer is option B, report the broken side rail immediately. Broken equipment is a safety hazard that must be reported to maintenance or the supervisor at once.
Question 24. If a nurse aide is concerned about client care, whom should they speak to first? Option A, another nurse aide. Option B, the nurse in charge. Option C, the director of nursing. Option D, the administrator.
The correct answer is option B, the nurse in charge. Concerns should always be taken to the immediate clinical supervisor according to the chain of command.
Question 25. If an alert and oriented client touches a nurse aide inappropriately, what is the best response? Option A, slap the client's hand. Option B, step back and ask the client not to do it again. Option C, refuse to care for the client. Option D, warn the client that they will be punished.
The correct answer is option B. Step back and ask the client not to do it again. Setting clear professional boundaries firmly and calmly is the correct protocol for inappropriate behavior.
Question 26. A nurse asks an aide to perform a task outside their scope of practice. What should the aide do? Option A, consider if the task can be done another way. Option B, provide the care and perform the task anyway. Option C, contact the ombudsman office. Option D, refuse the task and explain it is not within their role.
The correct answer is option D. Refuse the task and explain it is not within their role. Aide assistants must never perform clinical tasks for which they are not legally certified or trained.
Question 27. A charge nurse asks a nursing assistant to perform a task that is not part of their scope of practice. What should the assistant do? Option A, consider if the task can be performed another way. Option B, provide the care and perform the task as best as possible. Option C, contact the ombudsman office about resident rights. Option D, refuse to perform the task and explain it is not within their role.
The correct answer is option D. Refuse to perform the task and explain it is not within their role. Nursing assistants must never perform tasks for which they are not trained or legally authorized, as it endangers the resident.
Question 28. Which of the following should you observe and record when admitting a client? Option A, color of the stool and amount of urine voided. Option B, how much the client has eaten and drunk. Option C, bruises, marks, rashes, or broken skin. Option D, insurance information.
The correct answer is option C. Bruises, marks, rashes, or broken skin. Identifying pre-existing skin conditions upon admission is vital for accurate care planning and documentation.
Question 29. When arranging a residence room, you should do all of the following except what? Option A, check signal cords. Option B, adjust the back and knee rests as directed. Option C, administer medications. Option D, check the lighting.
The correct answer is option C. Administer medications. Administering medications is not within the scope of practice for a nursing assistant.
Question 30. When giving information to the charge nurse for an incident report, you should do what? Option A, write in the client's chart that an incident occurred. Option B, keep the report in your personal file. Option C, state the facts clearly. Option D, give your opinions as to the cause.
The correct answer is option C. State the facts clearly. Accurate, objective reporting is necessary for the facility to investigate and prevent future incidents.
Question 31. You hear other assistants discussing how rude a client was in the dining room. What should you do? Option A, join the conversation and share your own stories. Option B, suggest that this is not the place to discuss the client. Option C, record the conversation to show the nurse. Option D, ignore them and walk away.
The correct answer is option B. Suggest that this is not the place to discuss the client. Discussing residents in public areas is a violation of HIPAA and professional ethics.
Question 32. When a nurse provides you with confidential information about a client, what should you do? Option A, tell your friends about it. Option B, keep the information private. Option C, post it on social media. Option D, tell the resident's roommate.
The correct answer is option B. Keep the information private. Healthcare workers have a legal and ethical duty to maintain resident confidentiality.
Question 33. Which member of the nursing team is responsible for the entire nursing staff? Option A, the certified nursing assistant. Option B, the licensed practical nurse. Option C, the director of nursing. Option D, the medical doctor.
The correct answer is option C, the director of nursing. The director of nursing is the highest-ranking administrative nurse in the facility.
Question 34. The CNA witnesses a nurse giving milk to a patient with a milk allergy. What is the CNA's next action? Option A, nothing, it is not your concern. Option B, report this to the nursing supervisor. Option C, yell loudly for the nurse to stop. Option D, tell the patient that you are sorry.
The correct answer is option B. Report this to the nursing supervisor. The aide has an ethical and legal duty to report any unsafe practice to a supervisor to protect the patient.
Question 35. The CNA observes a client taking money from the purse of a visitor. What is the CNA's best action? Option A, tell the visitor about the theft. Option B, continue to do assigned work as usual. Option C, approach the client and demand the money. Option D, inform the nurse about what happened.
The correct answer is option D. Inform the nurse about what happened. Inform the nurse about what happened. The CNA has an ethical duty to report the theft but does not have the authority to intervene. The CNA should let the nurse or supervisor know, because that person is responsible for handling incidents and ensuring all policies are followed correctly.
Question 36. Who can order a warm or cold application? Option A. You as a CNA, if you think it is necessary. Option B. A nurse. Option C. A doctor. Option D. The director of nursing.
The correct answer is option C. A doctor. A doctor. It is important to remember that only a doctor can order a treatment, test, or medication for a client. This includes even simple treatments such as hot and cold compresses. A nurse aide can be fired or lose certification for initiating treatments.
Question 37. Continuing education is: Option A. A professional standard. Option B. Necessary for recertification in many states. Option C. Important for keeping abreast of new developments. Option D. All of the above.
The correct answer is option D. All of the above. All of the above. For healthcare professionals, learning does not end at graduation. Medicine is constantly changing, and it is the responsibility of each person to be aware of new developments in their area of practice. Also, clinical standards in many states require proof of continuing education in order to renew a license or certification. During an accreditation survey, hospitals and facilities must show proof that staff members are receiving ongoing training and education.
Question 38. A nurse aide notices blood in the patient's foretubing. The aide should: Option A. Stop the fore. Option B. Notify the fore nurse. Option C. Try to flush the tubing. Option D. Do nothing, that's normal.
The correct answer is option B. Notify the fore nurse. Notify the fore nurse. When an fore is running well, the tubing should be clear and the foresight clean and dry. If you notice blood in the tubing, notify the nurse. It is beyond the scope of practice for a nurse aide to do anything within fore.
Question 39. If the nursing care plan, you note that it is written, O2 per N/C at 3L, orthopnea POS, as needed. As a CNA, you know that this means which of the following? Option A. Orient the new client at 3 o'clock to the orthopedic unit. Option B. The resident is to be ambulated every 3 hours. Option C. Oral care must be performed every 3 hours. Option D. The resident is on oxygen with a nasal cannula on 3 liters. Assist to sit in Fowler's position.
The correct answer is option D. The resident is on oxygen with a nasal cannula on 3 liters. Assist to sit in Fowler's position. Resident is on oxygen with a nasal cannula on 3 liters. Assist to sit in Fowler's position. Every facility has a list of approved abbreviations. The CNA should become familiar with these, for reading care plans and for preparing documentation.
Question 40. Who is responsible for the entire nursing staff and the activities involved in providing safe care? Option A. A registered nurse. Option B. The supervisor. Option C. The case manager. Option D. The director of nursing.
The correct answer is option D. The director of nursing. The director of nursing. The DON is a registered nurse who oversees all patient care at a facility. They supervise all nursing staff, manage budgets, and handles patient and family issues that staff RNs can't resolve.